A high-quality patient experience is a central component of high-quality healthcare. But what does a high-quality patient experience mean? And how can we measure it in a way that's meaningful to patients? This is episode 4 of Pep Talks, the Patient Engagement Podcast. In this episode, I talked to Kyle Kemp, a PhD student in the Department of Community Health Sciences at the University of Calgary and a patient experience measurement professional. I asked him to tell me about interesting jobs that he's had.
One of the first jobs I ever had, I guess when I was 13, I actually had a paper route for my small community newspaper. So that was kind of cool. But yeah, one of the first jobs I ever had was in one of the summers when I was doing my undergrad in university, I did landscaping. And to be honest, that was kind of the hardest I've ever worked for the least amount of money I've ever had, which, and power to everyone who does that, because it's really not easy work. I mean, I got in great shape, but, you're out in 30-degree heat every day and it's raining, it's sunny, all things in between. So, and then one of the more interesting ones, and I guess, we'll talk about this more. It really aligns with some of the research I'm doing.
Sure.
Is one of my first research positions is when I was in grad school doing my master's at Dalhousie out in Nova Scotia. I was working as a research assistant for a prof who was a Canada Research Chair in behavioral medicine.
Okay.
So his whole thing was around barriers and facilitators and the behavioral components of why people exercise or choose not to when living with chronic diseases or chronic illnesses. So one of the things around that is he was looking specifically at barriers and facilitators for folks attending cardiac rehabilitation. So after they've had a heart attack or a major surgery, major heart surgery, they'd be referred on to this program, and, there'd be folks who would drop out of the program or, just simply wouldn't attend. So a lot of his research was getting at some of the factors associated with that. So it was really interesting work at the time. And I was really appreciative of the opportunity.
What about more recently?
Yeah, and more recently, in my day job, I work for the Health Quality Council of Alberta. Part of our legislated mandate there is to survey Albertans about their experiences with care. So once again, it aligns really well with what I'm doing as part of my doctoral research and the work of the patient engagement platform, of which I'm part of here in Alberta as well, as part of the Alberta SPORE. And previous to that, I worked with Alberta Health Services in their analytics department. Okay. And, we'll talk about that a bit more too. Really aligns with my current work and with my current studies as well.
Yeah, so a lot of what you've done then, I guess, revolves around trying to measure and understand the patient experience. Do you want to talk about what the major tools are that we have in Alberta and like how we measure that?
Yeah, absolutely. I mean, one of the major ways that we can measure patient experience, whether it's in primary care with their family doctor, whether it's after, being hospitalized, visiting the emergency department, et cetera, a lot of times we'll use a survey, and the reason why we do so is, surveys are typically validated. So they've gone through a lot of preliminary work to make sure that we're asking the right questions, making sure people are able to read the question properly. There's no misinterpretation on their part, really making sure that the data that we get from those surveys is robust and can really stand the test of time. So with that, we have lots of surveys across the province. I mentioned the Health Quality Council where I work. Of course, we do primary care surveys, surveys in continuing care. So those are things like long-term care, designated supportive living, and home care. And we also do a very large survey of the larger emergency departments across the province as well. And then I talked about Alberta Health Services. Their big ones over there is they do an adult and child hospital experience survey. So that's if you were hospitalized. And they also have surveys in cancer care. I know they have a very large survey over there. And they also do surveys of folks who've had the opportunity, or I guess the misfortune of traveling in an ambulance. They do an EMS survey as well, which is really interesting.
What sort of scope do these surveys have? Is it like how many people are asked about their experience every year, let's say?
Yeah, that's a great question. So obviously, we can't survey every person in the province, you know, from whatever sector. You
Hmm.
know, obviously there's a cost involved, and there's a time, and of course not everyone would respond to a survey. Firstly, so
Hmm.
we do a representative sample. In the case of those inpatient surveys, the ones that I mentioned that Alberta Health Services does, it's about 10% of the population who are discharged. So, you know, if you look at a hospital here in Calgary like Foothills,
Hmm.
and they discharge 20,000 patients a year, then their goal is to get 2,000 completed surveys across the board. So yeah, those are
Okay.
kind of the breadth of the surveys in terms of numbers.
Do you have any sense of what health researchers are doing with this data to maybe like understand what drives the patient experience here in Alberta?
Sure, that's a really good question. Here in Alberta, across Canada, and I mean even worldwide, there's lots of stuff going on with survey research. It's a really hot area of research right now. You know, the whole idea around patient experience is it's one of the key factors of the Institute for Healthcare Improvement's triple aim framework. And the triple aim encompasses improved patient outcomes, improved patient experience, as I just mentioned,
Hmm.
and cost effectiveness. So basically trying to reduce per capita costs of care. And the idea being is if you hit those 3 points, or if you're doing those 3 points well, you have a high functioning healthcare system. So that's kind of the guiding light or the North Star, I guess, for healthcare systems worldwide.
Hmm.
A lot of organizations, Alberta included, you know, they have a fourth component. So they'll call it the quadruple aim
Mm.
rather than the triple. And that brings in staff experience. So,
Okay.
you know, there's a lot of emerging research there to show that, you know, there's happy staff equals happy patient, or, you know, high experience in both.
Yeah.
And then, you know, we've been very productive here in Alberta as well. You know, we've published almost a dozen papers, I would say now, looking at results from the Alberta Health Services survey, looking at the experience of folks who've been hospitalized. And, you
Mm.
know, a lot of the low hanging fruit for that was quite simply, you know, what are the high points? What are the low points? So simply said, what are the areas of care that people hold in high regard? And what are some other areas that might be ripe for some quality improvements
Hmm.
across the board? We've also looked across certain demographics. So through that research, we were able to show that, you know, the folks who tend to be a little bit more dissatisfied with care are younger males, those with higher levels of education, those who tend to stay in the hospital longer. We
Mm.
think the reason behind that is, you know, the longer you're in hospital, the more that things could perhaps go off the rails, you
Yeah.
know, in terms of communication, or, you know, even expectations. You know, if you're told you're going to be in hospital for 4 days and you're there for 8,
Mm.
well, you know, obviously you're not going to be very pleased about that. So
Yeah.
some of that comes out in the survey data for sure.
What do you think like this research could do eventually? Like, can we learn from this at all and improve care? Like what are do you know of any like specific steps anyone's taken to improve the patient experience?
Sure. I think, you know, I talked about some of the low hanging fruit from a quality improvement perspective. That those are areas where, you know, feeding that data back to frontline staff, be it doctors, nurses, other clinicians, members of the healthcare team. You know, firstly, we didn't typically capture a lot of this data prior to this survey, so
Hmm.
so a lot of folks, you know, it's not really ingrained in them.
Mm.
You know, a lot of the quality improvement work that tends to be done in hospitals right now are focused around, you know, not only patient outcomes but also other measures that are important to hospitals. You think of things, you know, very high level indicators, or things like mortality, or, you know, reducing readmission rates. You know, those are all great and obviously are super important, but there
Hmm.
are other pieces of the puzzle that the patient can bring in via these surveys, you know, to really inform care and to make really impactful changes.
Hmm.
One of the things we're exploring actively with this data is, you know, we've talked about using the data in isolation, so, you know, using the survey results on their own. But one of the neat things that we're starting to do is we're starting to link up the survey data with other novel data sets. You know, like every time a patient is hospitalized, there's records about what they're hospitalized for,
Hmm.
whether they were discharged home, how long they stayed in hospital. You know, so, you know, one really good example is looking at elements of the survey, and is there an association with some of the things that people are saying about their care with things like hospital readmission rates. You know, and the one that really comes to mind for me is things around discharge planning. You know, and
Mm.
it's kind of intuitive. You could probably realize that, people are hospitalized for 4 to 7 days. If they're sent home, are we sending them home with the information they need about their medications,
Mm.
what to do if they have any difficulties or new symptoms or signs that would warrant perhaps further medical care? And is there any link between that and adverse outcomes?
Mm.
Things like being readmitted to hospital, or even if they have to visit an emergency department after. Which, from a health system perspective, we try to limit those types of visits in terms of volume.
Yeah, super neat. Yeah.
Mm-hmm.
So, among the many things that you seem to do, you're also doing a PhD. So, do you want to walk us through what your project's about and what you've found so far?
Excellent. Yeah, I'm right now. I'm a PhD candidate in the Department of Community Health Sciences at the University of Calgary, of course.
Mm.
And mine is looking at my research is being done in three parts.
Mm.
And we're focusing in on folks who've had cardiac surgery across Alberta. So people who've had things like coronary artery bypass grafting, valve replacement, those types of procedures. So really, really looking at that population in detail. So the first project in there was looking at their experience. So talking about the data linkage, pulling out patients who had those experiences, and really seeing where they thought their care was going really well or was provided quite well.
Mm.
And once again, things that maybe could be improved in the eyes of the patient. So that was the first part.
Mm.
And perhaps one of the most important findings from that is with all these surveys that we tend to use across the province, these are usually one-size-fits-all tools. And what I mean by that is they're not designed with any clinical population in mind.
Mm.
So if you break your hip and you have hip replacement surgery, if you deliver a baby, if you have cardiac surgery, you're asked all the same questions, which is great. But the idea being is you might be missing some important aspects of care
Mm.
that would be really important to clinicians in a given clinical area. So that basically was the impetus for part two of my PhD research,
Mm.
where I conducted telephone interviews with a cohort of patients who had cardiac surgery across Alberta, and a very organic type conversation in terms of what they thought was important to their care.
Mm.
Whether it was their interactions with doctors and nurses, information provided about pain, all those types of things. So the idea being is to incorporate their feedback with some of the existing surveys that we have here in the province to develop a tool specifically for those who've undergone cardiac surgery. So a little bit more detailed in those aspects that I spoke of earlier.
Mm-hmm.
And then the third portion of the project, which is just starting right now, is to test the survey. I talked about how we need to have valid data whenever we use a survey of these sorts. Is to validate it in a cohort of approximately 400 patients across the province. So the idea being is if a patient is discharged from hospital, we'll send them a survey. If they choose to fill it out, not only will we get their opinions about their care and then their feedback about their care, but we're also going to ask them some of those aspects that I spoke of earlier too in surveys. Were you able to understand the survey? Was it too long, too short? Those types of things. So yeah.
Neat. So because this is a podcast about patient engagement, do you want to talk about how incorporating the patient voice has gone with your project and what you found it's brought to your research?
Absolutely. Incorporating the patient voice in all of my research has been, just really eye-opening for me. I mean, as a researcher or as a clinician, we like to think that we have it all figured out, but we're really missing a really important aspect of care. And that's really what patients bring to the table through their own experiences with care. They kind of get a look under the hood, in our hospitals and in our emergency departments in terms of, what they see as working well or what can be improved, and in how we can even tailor some of our research projects. So really good example from my own is I spoke of the second project where I did telephone interviews. Well, I had a cohort of 3 patient partners who helped me put together some of the interview questions, helped me with my recruitment strategy, making sure that we're not missing folks who should be asked about their experiences.
Mm-hmm.
So simply said, making sure we're asking folks not only in the big cities like Calgary and Edmonton, but all points in between in some of the rural communities as well.
Mm-hmm.
About their own experiences, because those could vary, of course, in terms of that. So bringing that patient lens into, the co-design of the research project was really important, and really valuable insights from the patients.
No, for sure. Yeah. So recently, you published an article in the Canadian Journal of Cardiology that attracted a little bit of attention. So, what was that article about, and how have you been able to handle your newfound fame?
Yeah, I was really fortunate. We were able to publish that first study that I spoke of around the patients who had coronary artery bypass graft and/or valve replacement. That was published in October of last year, so in 2019, in the Canadian Journal of Cardiology. And the journal was kind enough to actually have an editorial that accompanied it about the value of this study, how it's a new way of looking at data and a new way of incorporating the patient voice into quality improvement, and basically talking about the potential for this data to really impact care going forward. So it was lovely. And then as part of that, the University of Calgary put together a little brief with the Department of Community Health Sciences, with the Libin Cardiovascular Institute. I'm also a trainee in the Libin as well, I should mention. And yeah, they put together a couple of press releases that went out, and one of them was fortunate enough to get picked up by CBC. So I was on one of their afternoon shows with CBC Edmonton, the radio show. So yeah, it was really neat.
Yeah. So do you think that there's an appetite then for learning more about patient-oriented research in the media and with the public?
I really do, because, as I talked about earlier, patients are the ones who experience care, and they're the ones who experience it from a different lens. I think you'd be hard pressed to find a clinician, who didn't get into it for the right reasons. Everyone wants to do a great job. And to be honest, whether you're a doctor, nurse, or care provider, any other type of professional, you always like to hear that you did a great job. You and I alike in our jobs, we love to hear that we're doing great. And it's great to get that feedback from patients, and not only to know where we're doing well, but, if I can improve even things like around my communication style or the way that I deliver care or do my day-to-day job, the patients are a valuable source for that feedback, because they're the ones that truly interact with those care providers. So I think there's lots of potential for this research going forward.
For sure. Yeah. So maybe let's say I was a new grad student. I wanted to do a patient-oriented research project, or a project that involves patients as research partners. What advice would you give me?
Well, I think there's, we've been really good in the province of Alberta through SPORE, the strategy for patient-oriented research. There are lots of resources for students and researchers alike across the province, for those looking to do this type of research going forward. So I would encourage them to reach out to SPORE, particularly the patient engagement platform. If they're using any data, administrative data, reaching out to the data platform, to basically get their expertise. And, unfortunately, a lot of projects in the past kind of had patients as an afterthought, unfortunately. And I think the pendulum has really swung. Some of the advice I've even received is it's never too early to have patients involved, whether you're co-designing a research project or, I talked about sometimes we have the best intentions, but, as researchers, we put together a research project, we think everything's going to go well. And then all of a sudden, my project included, as I discovered, maybe it wasn't the best fit for patients. I thought that, maybe something would work really well to fit their needs and their lifestyle. But in reality, patients who've experienced it are the best voice of what can work in that aspect. So yeah, I would encourage, getting patients involved up front and as soon as possible. Absolutely.
So thanks so much for joining us today.
Thank you, Paul. I really appreciate it.
Thanks so much for joining us for episode 4 of Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Strategy for Patient-Oriented Research Patient Engagement Platform. Special thanks to Sandra Zielinski for coordinating guest appearances, and to Brian Steele for his co-production. Make sure to subscribe to this podcast wherever you found it, and we hope you'll join us again for more interesting discussions about patient engagement in health research and healthcare.